how many times do we tell someone, what do you mean you were told that you should just get up and go and that you couldn't have any kind of relationship and you had a child and everyone's concerned about you being able to nurse during session? Like, we would be like, we need to pull out the DSM. Like, this is but this is where we reside. This is how long it took to anytime I share like my credentials, people are like, oh my God. Like, it's like, are you serious?
You know, I was going to ask you about a time in your life where everything was going well and people on the outside thought you were a rock star, but you were actually struggling. I don't think I need to ask you about that.
Yeah. Like, even when we talked today, I was like, listen, I'm super scattered. And I think one of the things that helps with social media is that I'm always very transparent about that. Like, I don't feel as though I don't feel any discomfort with stating that, like, oh, struggling with this, having issues with this, killing it at that, because that's normal. And I think when we think about like mental health and also like social media, we get this snapshot, but I try to like provide an example of, you know, you need to have humanity in your clinicians, and people think it's like the medication or it's the person, but the therapeutic alliance, like the mutual respect and trust and understanding that you have with your clinician will take you way farther than 50 years of their schooling. And you can't trust someone who you don't think is a human. Like, you can't trust someone who you think is judging you. And yeah, like it's pretty typical. Like, and I think I also name it in terms of like, we're residing in like a pretty oppressive environment most of the time. Technology is amazing, but also it makes people have access to us all the time. My mom's job would have never called her at home. They would have never emailed her. She didn't have a cell phone. I remember she had a beeper when she was on call, but that was it. Now it's like, we're giving you a work phone, or we'll contact you on your cell phone, or we'll also send you an email, or we'll send you a Slack, or we'll send you a Google Teams. And it's just like, none of this is appropriate. So please don't think that like, oh, you know, I'm not dealing with the same things. It's like, sometimes it's a swing and a hit. Sometimes it's a swing and a miss. Either way, I'm still swinging. And like, that's kind of what I'm trying to have people work on in therapy. It's like, oh yeah, I did a session with my shirt on backwards one time. And I was like, oh yeah, that's because this was the only thing that was clean. I grabbed it on the floor, but I was on time this session, right? Swinging a hit with the session, swinging a miss with the clothes. Like, my tab was right here. And I'm like, listen, we have an intense session today. I'm not about to take this shirt off. Let's go. Like, you know, like we have goals. Don't focus on this. Don't use me to distract you from, we said we were talking about this today. Don't look at my shirt. Tell me what the progress is, you know? So I feel like it's good to normalize that, because it takes away from people thinking they can't go to therapy. Everyone's having a difficult time, but I would trust someone who admits to being wrong way before I trust someone who says they're right all the time. I would never trust that person. That's like being in a relationship with someone who all of their exes had problems. Like, all of their exes had problems. And the only common denominator is the person you're sitting across the table from. And it's like, this is how he's going to talk about me. This is how he's going to talk about me when I leave him, like I was a problem.